tamang paraan ng paghuhugas ng kamay. Una, basain ng tubig ang mga kamay at sabunin. Ikalawa, sabunin ang mga palad. Ikatlo, sabunin ang likod ng mga kamay. Sumunod, kuskusin ang mga pagitan ng daliri. Ikalima, kuskusin ang mga kuko. Ika-anim, kuskusin ang pagitan ng mga hinlalaki. Pagkatapos, kuskusin ng paikot ang mga dulo ng mga daliri sa magkabilang palad. At panghuli, banlawang mabuti sa malinis na tubig at patuyuin ang mga kamay gamit ang single-use towel o air dryer.
Apply a palmful of alcohol-based hand rub in a cupped hand. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. Clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Step 1, let's open my package. Inside this one will be a second sterile package that contains my gloves. I'm going to go ahead and open this second sterile package. Unfold the top and the bottom flaps, and then along the middle you can see the other flap that you'll put your fingers underneath and pull open. My left hand, I'm going to create an opening at the base of the right glove so I can slide my right hand in, dropping the cuff. My now right hand is sterile. I'm going to go underneath the cuff of the left-handed glove, create a pocket so that my left hand can slip into the glove. And as you're sliding your glove on, you may notice that your fingers don't always go into the right spot. That is okay, just take a moment. Extend the cuff and drop it. Now you can take your sterile left hand under the cuff of the right hand, extend it and drop. Seat the fingers, make sure the gloves are nice and snug, and you're ready to go. Now at the end of your procedure, you want to remove those gloves. Grasp the inside cuff of one hand, pull it down towards your fingers, containing all the contamination inside. Slip your clean hand under the cuff of the remaining glove and do the same, removing both gloves together. And now all you need to do is wash your hands and you're done.
Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, Hook them around your ears. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
Place the package containing the sterile drape on a flat, dry surface. Open the outside cover. Grasp the folded top edge of the drape with the fingertips of one hand. Gently lift the drape from its wrapper without allowing it to touch anything. Let the drape unfold, holding it away from your body and keeping it above your waist and the work surface. With your other hand, carefully discard the wrapper. Then grasp the adjacent corner of the drape and hold it straight over your intended work surface. Position the bottom half of the drape over the top half of the work surface. Then allow the top half of the drape to cover the bottom half of the work surface, creating a flat, sterile field for placement of sterile supply. Place the package on your work surface. Grasp the outer surface of the tip of the outermost flap. Open the flap away from your body, keeping your arm outstretched and away from the sterile field. Then grasp the outside surface of the edge of the first side flap. Open the flap by pulling it to the side and allowing it to lie flat on your work surface. Be sure to keep your arm to the side and not over the sterile surface. Now open the second side flap the same way. Again, watch your arm. Don't allow it to extend over the sterile surface. Next, grasp the outside border of the last innermost flap. Stand away from the sterile package and pull the flap back, allowing it to fall onto your work surface. Now the opened package wrapper is ready to serve as a sterile field. To maintain the sterile field, remember these principles. A sterile object remains sterile only if objects that touch it are also sterile. A sterile object becomes contaminated when touched by any non-sterile object.
So if you're opening your tray this way, turn it around so that when you lift that first flap, it is away from you, and that will help us maintain that principle. We're going to continue to unfold these flaps, and what we notice as we unfold the last flap is there is a sterile transfer forceps. We're going to remove the drape and the garbage bag, and then I'm going to take the transfer forceps to grab onto my working forceps and put them to the 1-inch border of my drape. The 1-inch border of my sterile drape is considered contaminated and is where I will put the handle of my forceps. The next I'm going to remove my 2x2s and 4x4 so that my tray is empty and it can be an additional workspace. At this point, the blue transfer forceps are no longer needed and I'm going to discard them. I'm going to position above the tray, but we do not want to touch it, and close enough so that we can pour without creating a splash. To grab the outer edge of your forceps within that 1-inch border of your sterile drape. To prepare our first 2x2 to clean a wound, we're going to need to make this into a thicker wad of gauze. So we're going to make what we call a wonton. Bring in the opposing edges together and then collect the remaining edges in towards the center so that we now have a thicker 2x2 mass to work with. Dip it into your saline solution, and if there's too much water on there, you have your third drawer in your sterile dressing tray to squeeze out excess. Now you're ready to clean the wound.
You're ready to add a sterile item to it, open the item according to the package directions. Be sure to hold the outer wrapper of the package in your non-dominant hand. Carefully peel the wrapper down over your non-dominant hand. Place the sterile item onto the field at an angle, taking care not to let the wrapper fall down and contaminate the field. Remember, don't reach across the sterile field, and don't flip or toss objects onto it. Keep in mind that a 1-inch border around the edge of the field is not considered sterile. Discard the outer wrapper of each sterile item. Repeat this process to add other sterile items to the field as needed.
Shitty of you to make me feel just like this.